Hi everyone, welcome to another Health Talk with Precious, your go-to series for staying informed, healthy, and empowered. Today we are going to be diving into something that can make all the difference in your life: health screenings. Yeah, those tests that we sometimes avoid or we push to the back of our minds. I get it. Life can get a little bit busy at times, but trust me, giving this a little attention now can save you from a lot of trouble down the road or in the future. So stick with me for the next few minutes and I'm going to explain to you why regular health screenings are more important than you think. So let's start with a question. How often do you think about your health? Well, I'm talking about the checkups, the tests, and the simple screenings that can help us stay ahead of potential health issues. Now, I know what you're thinking. Do I really need that? I feel fine. I don't need to see a doctor unless something is wrong. And I get it. But here's the problem, or here's the thing. Health screenings are like a safety net. They help to catch potential problems when they are still small or at that little stage and make it easier for us to fix them before they become big or serious issues. So let me break it down. Blood pressure, cholesterol levels, cancer screenings, etc. This may sound like things that are just for older folks or older people or something that you do only when something is wrong, right? But actually, that's not true. Regular screenings are important at all stages of life, whether you're young or you're old, and early detection through screenings can help save your life from greater danger. Now, here's why. Let's start with blood pressure. A lot of people don't realize that high blood pressure can go unnoticed. You may feel fine, but your blood pressure could be creeping up without you even knowing it or without you even noticing it. And high blood pressure is very dangerous because it puts a lot of extra strain on your heart, your arteries, and even your kidneys. And if you allow this unchecked, it can lead to a heart disease, it could lead to a stroke, it could lead to a kidney failure. But guess what? A simple blood pressure check can give you all the information that you need. So that is why it is very important for you to have regular health checkups. Now you're probably thinking, okay, I get it. High blood pressure is a big thing, but what about cholesterol? You're right to ask that question. Cholesterol is one of those silent problems as well. You might have a high cholesterol and you may not even know it, you may not even notice it. It's something that builds up in your blood vessels over time, which could lead to blockages that may result in heart disease or it could also result in stroke. So getting your cholesterol checked regularly is a simple blood test that can give you the peace of mind that you need. And if you do the test and you have a high level of cholesterol, your doctor can recommend steps to lower it before it causes damage. It's really that simple. Alright, so let's talk about something that can be a little bit more intimidating, but it's just as important: cancer screenings. Now, I know cancer is a scary word to use, but here's the reality. Early detection is key when it comes to cancer. The sooner you catch something, the better your chances of successful treatment. So, for example, breast cancer and colon cancer are among the most common types, and both can be detected through regular screenings. For women, mammograms are the go-to for detecting breast cancers at the early stage. The American Cancer Society recommends starting mammograms at the age of 40 and continuing every 1 to 2 years. For men and women, colonoscopies are super important after the age 45 to screen for colorectal cancer. And colon cancer is one of those cancers that can be completely preventable with regular screenings. I know that colonoscopies aren't exactly something that we are excited about. They can feel a little uncomfortable, right? But think of it this way: you're investing in your health. A quick procedure every few years could save you from years of unnecessary suffering. And the earlier something like colon cancer is detected, the easier it is for you to treat. Now let's shift gears a little. I know that we've covered a lot of different screenings, but here's the one thing that I really want you to take away from the message of today. Screenings are important because they help you stay on top of your health even when you feel perfectly fine. They are proactive and they are preventive. Now think about it. How often do you go to the doctor for a checkup? If you're like a lot of people, it's probably when something feels off. But that's not always enough. So what will happen if you're feeling fine but have an underlying condition that has not shown any symptoms yet? Early detection can catch those issues before they become a bigger problem. And I'm not just talking about heart disease and cancer, I'm also talking about diabetes. Diabetes does not always have noticeable symptoms, and many people nowadays are walking around with undiagnosed diabetes. And the longer you live untreated, the more it can affect your organs, your eyes, your nerves, and everything. But if you get your blood sugar checked regularly, you'll be able to know where you stand and how healthy you are. Managing it early means preventing complications later on, and that is what screenings are all about: helping you live longer, healthier life with fewer setbacks. But it's not just the big things like cancer or diabetes that we need to worry about. There are other important screenings that we often overlook, like tests for HIV, hepatitis, and other infectious diseases. And these screenings are especially important if you have risk factors like unprotected sex or a history of intravenous drug use. HIV and hepatitis can be managed more effectively if detected early, and knowing your status is crucial for protecting both yourself and others. Getting tested for HIV or hepatitis may feel uncomfortable, but just like other screening, it's all about your peace of mind. And these conditions can be managed or prevented if caught early, and these diseases don't have to define your future. Regular screenings for things like this are a part of taking control of your health. So you might be asking, what happens if I don't get screened? Well, the reality of it all is that skipping these important health checks can lead to delayed diagnosis. And early stage diseases are much easier to treat and manage than those that have been left to develop over time. And that is why it's so important not to wait for symptoms to appear before taking actions. Now I want us to talk about a bigger issue that many people face when it comes to health screening: access. In undeserved communities, affordable health care and screenings are not always available, and a lot of people are unable to afford to get checked. which makes them miss out on this potential life-saving test, which is a huge problem, right? So, what can we do? We all deserve the same access to healthcare, and no one should have to wait until they have become really sick to get the care that they need. Early detection should be available to everyone, no matter where they live or how much money they have. So, what can you do? You can start by being proactive with your health, by making those appointments. And if cost is an issue, you can equally ask your healthcare provider about programs that offer free or low cost screenings. You can equally advocate for better healthcare access in your community. The more we talk about it, the more we raise awareness on the issue. So let's have a recap. Regular health screenings like blood pressure checks, cholesterol tests, mammograms, colonoscopies, HIV, diabetes checks, and hepatitis screenings can save your life. They can prevent serious health problems before they start or catch them earlier when treatment is most effective. And the earlier you detect a health issue, the better your chances of managing it with less risk and fewer complications. So, what are the importance of regular health screenings? Early detection of diseases, prevention of serious health conditions, improved quality of life, cost-effective health management, personalized health insights, prevention of chronic illnesses, peace of mind, family health awareness, building healthy habits, enhancing public health. If you have not had your screenings, go ahead and schedule them. Also, encourage your loved ones to do the same thing. It's one of the simplest, most effective ways to protect your future. Thank you for joining me today on Health Talk with Precious. I hope this conversation was helpful and that you're feeling empowered to take charge of your health. If you found this useful, make sure to share it with someone who might need a reminder to get screened. And don't forget to like, comment, and subscribe. See you next time with another health topic. Thank you.